please join me in welcoming Dr. Hans Haus to the Iowa City Foreign Relations Council to speak on the inevitable pandemic of COVID-19.
All right, first thing I'm going to do is I'm going to model some good behavior. I just shook Tice's hand. I'm going to clean it with hand sanitizer. That is the take-home message today. This is a scary topic. And yes, it is not technically a pandemic according to the World Health Organization, but everybody is, and public health experts are basically assuming that if it's not yet, it certainly will be in the future. It is okay to be scared. I'm here just to try to reassure you and try to give you some information so that you don't panic about it. Okay. And I'll begin, as I have in the past, with a historical perspective. I want to talk about what the COVID disease is, what causes it, what it does to the body, a lot about the epidemiology and the spread, and that's going to give you an idea of why it's a challenge to contain this virus. And how do we cope with this? What does the future look like? We'll try to get a little glimpse of where we go from here. And if you've heard my talks here before, I've begun with this same slide. I'm going to do it again because this is really important to understand that this has happened before. And this will happen again. New diseases come all the time. Let's begin in 1346 in the Crimea, in the city of Kaffa. It's a Genoese trading post, and it's under siege by the Tartan army. A strange disease breaks out among the Tartans. They take some of those diseased bodies and they lob them over the walls into the city. Now, the Genoese manage to escape. They get on boats, they go back to Sicily, and the rats from those ships leave the boats and take up residence in the thatched roof huts of the people of Sicily. And for the next 12 years, the Black Death rages across Europe. It kills a third of the population. In 1918, in an army barracks in Kansas, there's an outbreak of respiratory illness among recruits, military recruits. Certainly, that's not unusual. What is unusual is the virulence of this particular strain in killing otherwise healthy young men. It spreads throughout the world, affects millions of people, hastens the end of World War I, and then you get all those soldiers returning from the war, mobilized throughout the world, and you get a second wave of this Spanish influenza. In the end, 20 to 50 million people are killed. In 1976, in Zaire, now the Democratic Republic of Congo, a patient shows up to the Yambuka Mission Hospital. He's got this strange illness of fever and diarrhea and vomiting, and he's got blood in his vomit and blood in his diarrhea. And he dies. And the needles used to treat that patient are washed and reused in other patients. Of the initial 318 cases, 280 people die. 88% mortality rate. This new disease is named for the river nearby, the Ebola River. And many of you here remember SARS, which happened fairly recently in 2003. And that year in February, a doctor from southern China checked into the Hotel Metropole, to the 9th floor. And guests that were staying on that floor would have been exposed to him coughing or touching the elevator buttons or vomiting on the carpet. And if you were on that floor of that particular day, you went back to your homes and you started clusters of this new disease. The disease had been going on in southern China since November, but nobody had heard about it. And so people went back to other parts of Hong Kong or to Singapore or Vietnam or Toronto, Canada, and started clusters in those areas. And what's connecting all these features is you've got a novel agent, a new infectious agent, introduced into a susceptible population with the right mix of factors that allows it to spread, and in some cases spread around the world. Speaking of which, this is a graph showing all the airline flights in the world. Every little yellow dot is an air travel. And as the day spreads across the world, you'll see an increase in the number of yellow dots. See Europe light up. So I want you to notice a couple things about this graph. First of all, in China, there's lots and lots of airplanes. There's not so many right now, but there's lots of airplanes there. And where they go to Japan, they go to Korea, they go to Singapore. They go around the world. And what you don't see, look in Western Africa. Remember where the Ebola outbreak was? I spoke about Ebola here. We had over 10,000 cases, and it was very little spread around the world. There's very few yellow dots in Western Africa. So that's why where these disease starts and where it can spread is very important, very predictable. So what does the coronavirus look like? No, not like this. The coronavirus is a ring. Now, actually, I'm wearing my coronavirus tie today. Yes, I actually have a coronavirus tie. I had it before this came out. I'm the OG tie. So it looks like a ring. It looks like a crown. And that's where the name comes from, corona. This particular virus is technically named SARS-CoV, basically the second SARS coronavirus. And those knobs, which you're seeing in those crowns, are little protein particles on the surface of the virus that allows it to bind to receptors. It binds in receptors in the respiratory tract, in the upper respiratory tract and the lower respiratory tract. And when something binds in the lower respiratory tract, you get cough, you get bronchitis, you get pneumonia. When a virus attaches to the upper respiratory tract, it causes congestion, sore throat, runny nose, cold symptoms. And this can do both. I can tell you, everyone in this room has had a coronavirus because the coronavirus is one of the causes of the common cold. There's many. This is a unique one that unfortunately has some other effects. So what do you see? What does it cause? What do people get when they get coronavirus? Most patients are going to get a bad cold. 80% of cases are mild. You get sore throat, you get fever, you get runny nose, you might get a cough. That's about it. You're going to be fine. And a lot of patients, and we'll see later, don't have any symptoms at all. About 14% of patients will get so sick that they will actually seek medical care. They'll actually go to the hospital to get care. And 5%, 1 out of every 20 cases, are going to require an ICU admission. Now, 1 out of 20 doesn't sound like a lot, but when you multiply that by the tens of thousands of patients that are in Wuhan, China, you can see quickly how the medical system, the ICU wards, would be completely overwhelmed by a massive outbreak. So most of these cases are in older patients. What's interesting about this virus, about COVID, is it almost never affects children. So people under 15 are relatively spared from this disease. Overall, the mortality rate is about 2%. The mortality rate for influenza is about 0.1%. So this is more dangerous than influenza. Most of the patients who die from this are older. If you look at the deaths by age category, it's that older group that are really at higher risks. So as we talk later about travel plans, it's that category, that age group category, the older person who needs to really be consider their travel carefully. We'll talk about that. What does it look like? It looks like multi-lobar pneumonia, many different lobes, acute interstitial infiltrates, so like patchy infiltrates of the chest X-ray. This is ARDS, acute respiratory distress syndrome. Basically, the lungs fill with fluid. Now, these pictures are not from COVID. These pictures are from MERS, the Middle East Respiratory Syndrome, which is very similar. But COVID's going to look the same. Where did it come from? And this is a big area of debate right now. This email, what you're seeing here, is the first report outside of China to this disease. This is something called ProMedMail. It's a website that collects reports of new diseases and reports them and concerns about. I get basically a email each week with what the new reports are. And this is the one that came out on January 2nd. And it was reporting a press article in China, translated from Chinese, about the closure of the Wuhan wildlife market. So that announcement of the closure on January 1st in the Chinese popular press was the first anyone in the West or anyone outside China had heard about this disease. It had been going on in Wuhan prior to this. The Wuhan market, the wildlife market you've heard about that closed down, was absolutely the first major cluster of this disease. It's not clear if that's actually where it jumped from animals to humans. There's a pretty good study which suggests that that jump from animals to humans happened before that market, but the market was a place where humans gathered and gave it to each other, and that created the first big cluster. So this has been going on in China for at least a month prior to this announcement. So how did the Chinese spot it? How did it come to the attention of the Chinese authorities? They have since the SARS epidemic, there is a surveillance mechanism there called pneumonia of unknown etiology, which healthcare workers will report to this Chinese CDC if they have a case of pneumonia that doesn't respond to antibiotics, that's particularly severe, that's kind of weird in some way. So that's a pneumonia of unknown etiology. And the CDC collects those reports, and they notice that when they have a spike in those cases, that means they have emergence of a new disease, SARS or avian influenza. This is how the bird flu was spotted. So in those cases, when they have a spike in PUEs, they're going to close the LPM, the live poultry markets. They're going to close the live bird markets, and then, in general, that then wave of pneumonias then decrease. So by maintaining this surveillance system, they can spot sort of new viruses showing up, that the new viruses that spread between humans and birds, between humans and pigs, mostly in the case of influenza, but unfortunately in this case, in the case of coronavirus. So if closing the live poultry markets causes decrease in these PUEs, why have the live poultry markets in the first place? That's a great question. And this gets back to another good question, which I get all the time, is why does this stuff always start in China? SARS started in China. Bird flu started in China. COVID started in China. Why does this stuff always start in China? And it's a combination of a number of factors. Yes, there are some cultural factors in that having those live markets where animals are butchered at the point of sale are going to cause increased mix in the exposures. This is a picture, an example where you can see throughout the image where animals are being butchered, and you can see where you potentially would have exposures or areas of contamination. More than anything else, it's simple mathematics. There's a lot of people in China, and there's a lot of pigs, and there's a lot of birds. And when you get that mix between those three species, because of the recombination of influenza specifically, you're going to get new viruses pop up. So remember the last big pandemic, H1N1, it was 2009? Where did that start? Mexico, not China. So it's not always China. So where did this disease come from? This is the pangolin. Pretty adorable, isn't it? So we don't know yet. There's a theory, and it has not been established, that the reservoir for this disease may be the pangolin, which is this small mammal covered with scales, and is used in Chinese traditional medicine. The scales are particularly valued as part of the medicine. So this animal is trafficked and raised and harvested for its scales. Unfortunately, one of the side effects of this whole epidemic has been an increase in racism toward Asian persons in general. You've heard lots of reports of arguments in the subway or people being attacked on buses. Just on my social media, I get a lot of reports. One colleague in Iowa who looks kind of Asian was coughing on the bus, and basically the whole bus cleared out. And all of a sudden he was like, had his whole road to himself. He was quite happy with that. My colleagues in emergency medicine keep reporting, patients coming to the ER with kind of strange complaints like, oh, I want to get tested because, I was riding on the bus with an Asian person. I want to get tested because I was walking down the street and I saw an Asian person cough or something. Or my favorite is, I ate bok choy and I got sick. Because, that's Chinese cabbage. And this is a handout distributed by Student Health at UC Berkeley when this epidemic started. And the idea is it's trying to reassure students that it's okay to be scared of this. And this is one of my messages to you. It's okay to be scared about this virus. Just don't panic. So this handout listed some normal reactions to hearing about the epidemic. Xenophobia is not a normal reaction. So fortunately, they pulled this handout. Let's spend some time talking about the epidemiology of COVID. It would be terrifying to be in Wuhan right now. It is, the streets are shut down, people stay inside, the place is like a ghost town, and this is a city of millions of people. It's right out of a science fiction movie. This graph is from Wikipedia. They're doing a great job in keeping it updated. I had to keep putting the updated slide in like every couple of days. So I put this in from last night. It just shows the growth of the virus around the world. And if you had to pick one place in China for this disease to start, Wuhan would be a good one because it's connected in the center of China, and it's connected to the rest of China by high-speed rail and by rail, and by airlines. And so it's very easy as a crossroads of travel throughout China for an epidemic that starts in that city to spread to the rest of the country very, very quickly. When you go through an airport, especially international airport now, you're going to see scanners. You're going to see people with these infrared scanners measuring people's temperature, or handheld scanners measuring people's forehead temperature. And the idea is you're scanning for you're screening for fevers, and you're then do more testing on those people that have fevers. It's a nice way of screening a large number of people, especially coming through an airport. It's not particularly effective. So we know from the SARS epidemic that this doesn't necessarily work. So how contagious is COVID? The measurement of contagiousness of a disease is its reproductive rate, or R naught, R with a little subset 0. So when you describe a disease and how much it spreads, you're describing its R naught. And for example, let's talk about SARS. SARS has an R naught, let's say, of 4. And that means one patient, is going to spread to 4 more people. And those 4 people are going to spread to 16 and 64 and so forth. And so you can see how the higher the R naught, the faster that exponential growth would be in an epidemic. And the R naught is not stable. So it's going to change depending on what you do to control the disease. The record in the medical literature for R naught is measles, as high as 18, meaning one person can give it to 18 other people. So you can see how quickly that would spread. The R naught for COVID is probably between 2 and 3. So, kind of to say. But as we know from SARS and from MERS, there are definitely cases of patients that spread it more easily. We call super spreaders. And they just, for some reason, shed more virus. They shed more virus in their secretions, or in their mucus, or in their diarrhea. And they're going to spread more to people around them. And so whereas the average R naught might be 2 or 3, there's going to be cases where you have people spreading it to 5 people, or to 10 people, or to more. And this is a famous case of a British man who was in Singapore at a conference probably acquired the disease there, then traveled to France and had a ski vacation in southern France, created a cluster there, and then traveled home to London and created a cluster there. I want to take a few moments and talk about the Diamond Princess ship. Because as horrific as it would have been to be on this ship and a terrible story for those that had to go through it, it does provide a natural experiment for us to get some idea of how this might spread and what the epidemiology of COVID is. So let me remind you a little bit about how this ship went. So you have this cruise ship that leaves Yokohama, Japan on January 20th. On January 25th, it's in Hong Kong, and at that point, someone is on board who's sick, gets off the boat, and seeks medical care in Hong Kong, and he stays on shore, and the ship keeps going. On February 1st, that patient tests positive for the virus. So authorities are alerted. Japanese authorities are told this ship has potentially exposure. When it arrives in Yokohama back on February 4th, the ship is quarantined. People are kept on the ship. 4 people that have tested positive are taken off the ship for treatment. And the idea is the ship's going to stay there and wait for the 14-day quarantine period before people can come off. People are allowed to interact. They have food together initially. Then 41 more patients test positive. A couple days later, 66 more patients test positive. People are told to stay in their cabins. People are told to stay 6 feet away from each other. Food is delivered to the door in little box lunches, and people are kept isolated. 39 more patients test positive. At this point, the United States has had enough. They're going to evacuate their citizens. They get a plane there. They get one plane there to take people back. And they put people on the plane that are sick and aren't sick together and fly them back to the United States. And over the next couple of days, you have, basically scores more patients testing positive. The longer this quarantine goes along, the longer you have basically incubation for this virus. Finally, on February 20th, the ship is emptied. The sick people are taken to hospitals. Eventually, 3 of those people die. So, what do we learn from this very unfortunate experience? The most important thing is, out of those 691 total cases that tested positive, 2/3 never had symptoms. 2/3 never had symptoms. It is absolutely for certain that you can have the disease, spread the disease to other people, and not get sick. Remember that was 80% of cases are mild? The amount of you notice you have the symptoms. That makes it really hard to contain, especially in a closed environment like the ship. Now, the other big question comes up is, how is this spread? Is it droplet versus airborne? And this is an important question. I'm going to pause and talk about what those mean. So when you're in the hospital and we have a patient, we can put them in different types of isolation. If someone has a bad diarrhea, we're going to put them in contact isolation. Everybody puts gowns on, everybody puts gloves on, that kind of thing. If you come in with the flu, if we think you have meningitis, we're going to put you in droplet isolation, which means we put on a simple surgical mask on the patient. That's all we need to wear when we're in the room. And you should be safe if you're 2 meters away from the patient. That's droplet isolation. Big droplets being transmitted by mucus. Finally, there's airborne. And there's only a few diseases that are true airborne transmission or aerosol transmission, stuff that can linger in the air for hours. Measles is a great example. Remember the really high R0 for measles? Okay, so measles is a good example of that. Also chickenpox, also tuberculosis. And those are considered airborne transmission. And for those, we use a special mask, the N95 mask. It blocks 95% of particles of 0.3 microns or bigger. So that's airborne. So SARS and influenza, it's considered to be droplet transmission. So when people are on the Diamond Princess, they put them in the rooms, they were told to stay 6 feet away from each other. It shouldn't be carried between the cabins by the ventilation system. And yet people got sick. So is this actually airborne transmission? Possibly. But it also is transmitted. This is super important. This is one of the big take-home points today. This is why I started by washing my hands. This and SARS is absolutely transmitted by contact, by surfaces. That big epidemic of SARS that started in the hotel, it's because of surface contact, because of contaminated surfaces. So that's why hand washing is super, super important. And those little meals left outside people's rooms at the cruise ship, they could have been contaminated, and that could be the source of the spread, not necessarily the airflow between the rooms. However, we don't really know. And I'll tell you what's really interesting is in January, before this happened, and I checked the CDC website, I wanted to know what to do with the patient that I had that I was screening for coronavirus. The recommendation was droplet isolation. I go back and I look today, and the recommendation is airborne isolation. So there was clearly a change in the CDC recommendations before and after the Diamond Princess event. So they won't tell you actually it was caused by that, but that certainly happened. So there is debate in the medical literature now about what actually the transmission is. As far as you're concerned, if you're a healthcare worker, you're taking care of a sick patient, you're going to be using the N95 mask. That's the higher quality mask, and we're going to use airborne precautions for those patients. This is my family. This is my wife and my daughter, and this is us in Japan. We were there 2 weeks ago. Had a fantastic trip. It was great. We did not get sick. It was good. And the question that comes up all the time is, should you use masks? Should we use masks in public? It's very common, especially in Asian cultures, to use masks all the time, even when people are not sick. So you see masks a lot, especially in Japan when we were traveling. And there's quite an obsession about masks in that area now, especially now. This is a picture of some men using masks as poker chips in a poker game because they become value commodities. Or if you can't have a mask, you can just cover your entire child with a plastic bag. Please don't suffocate them. This creates a shortage of masks. So people are getting creative about how they create a mask. So they made this one out of an orange. At least it's going to smell better, right? That's something. And of course, The Onion had a great take on this, which was make sure you wear one on the back of your head as well, in case you get attacked from the back. You don't need a mask to protect yourself from coronavirus, especially in the United States and especially in Iowa City. Okay? If you're a healthcare worker and you're taking care of a suspected case, yes, you should wear a mask, and we're going to use the good N95 mask for that one. If you are sick yourself, if you have a cold, if you have influenza and you're going out, you should wear a regular surgical mask to prevent those droplets from coming out of your mouth and infecting other people. This is to protect others when you're sick. Okay? But don't rush out and buy a bunch of masks for your family and for yourself, and keep a stockpile in your household. The prices in Amazon have pretty much gone like 5 or 10 times what they used to be. And there will be a shortage, and there will be a shortage, especially if we get more cases here. And we absolutely need those masks for people that are providing care in the hospital. So to protect yourself, clean your hands. Clean surfaces, super important. Who's seen the movie Contagion? Okay, everybody who didn't raise their hands, you now have a homework assignment. I love this movie. I loved the movie when it came out. I've watched it a few times since then, and I purposely watched it on the plane home from Japan. It was terrifying, and I loved it. It was fantastic. I love this movie for a lot of reasons. One is because it is perfectly realistic. Almost everything in the movie could totally happen, and the writers actually based it on the SARS outbreak. So the stuff that happens in Contagion is totally relevant for what's going on today. It seems very real. The only difference is this: the fictional virus in Contagion has a higher mortality rate. Other than that, almost everything in the movie could happen. And this tagline is super important. Nothing spreads like fear. And the panic over this virus is probably just as dangerous as the virus itself. Now, the one thing in this movie that was not realistic is how they dealt with the vaccine, okay? But it's okay. It was Hollywood. The rest of the movie was perfect, so it's good. And so I want to tell you about the vaccine for COVID. There are at least 8 vaccine candidates currently working through the system from different countries. The Chinese were very good about publishing the DNA sequence for the virus as soon as they had it, which is really great. So people started working on a vaccine candidates right away. There was at least one company that has already submitted their candidate for animal testing. We are not there yet. The vaccine is at least a year away, probably more. But it does. But this process does work. Remember the Ebola outbreak? Remember I came here and talked about Ebola, and it was at the tens of thousands of cases and how awful it was, and we had maybe some candidates. We have a vaccine for Ebola now. It's a company in Ames that helped produce it. It works. It's being used in the Congo today. So science works. Well, we will get a vaccine for COVID, but it's going to take a while. There are some antiviral therapies. Maybe they're out there. There's one that shows a lot of promise. In desperation, possibly medications that we use for HIV have some effect against this virus as well. Okay, so that's what's going on now. So what's coming down the line? There's absolutely going to be an impact on economic growth. We're seeing that already. The markets reacted to it quite strongly this week. But China's economy is absolutely going to have decreased, have less growth than they would have. Is that going to drive the United States into recession? I don't know. It's a possibility. It really depends on how many cases we get here and how long the slowdown in China occurs, how much disruption there is to the supply chain. I think one of the potential threats, if the virus comes to the United States and gets established in the United States, it's not yet. And it might be a while before it is. If it's circulating in the community, you're going to have people trying to stay inside. These kind of gatherings will be a bad idea. Having a buffet is a really bad idea. Wash your hands. Going to movie theaters, say you're on the board of directors for a local nonprofit cinema, for example, that's a threat. You're going to have decreased attendance. And I'm sorry to say, but the Hawkeye football season could have some problems if people are going to be restricted from going to the stadium because of gathering in big places. For me, in emergency medicine, the challenge that we face, and something my colleagues and I are talking about a lot right now, is the being overwhelmed by patients, but mostly by worried well patients. So we see this every year with flu season, and we saw this a lot in 2009 in the H1N1 pandemic, where you had people come to the ER because they heard about this virus and they had a fever and they want to see if they have the virus. If you're fine, I don't care. Stay home. Stay in your homes. If you're a student, if you're a young child, you're basically not in any danger from this virus. Please stay home and don't affect others. You can transmit it even though you don't even know you're sick. But if you're older, if you have comorbidities, that's when you want to seek care. We want to make sure that we have those ICU beds available for those patients if we need to, and the equipment to do so. So panic buying of N95 masks on Amazon doesn't help us. A lot of the questions I'm getting now is about travel. And one of my things I do is travel medicine. So I advise people on travel, and I help take care of people that are traveling and if they have diseases overseas. So this is something I'm very used to doing. It's a tough decision. I'm going to give you some very general advice now. And I'm happy to stay long today if you want to have individual questions. I've already had a couple questions, and I'm happy to, and that's fine. I'm happy to answer it. And I brought a big stack of my business cards in case you have more questions. That's okay. Don't be afraid to ask. So general instructions. Follow the CDC website and follow the health advisories on that website. That website now says do not go to China. So don't go to China. It also says reconsider or be wary of travel to Japan and South Korea. Other countries, there isn't really any concern. If you are a high-risk patient, if you're an older person, if you're a person that has comorbidities, especially cardiovascular disease or lung disease, you want to be particularly concerned. That's a situation where you want to be careful. If you are a college student and you're planning to go to Mexico for spring break, please go. Mexico, South America has no cases, 0, and you're in the lowest risk category. Have fun. Don't get too drunk. If you're traveling domestically, there's really no concern. Not yet. If you have an international trip planned, and this is the big one, if you have an international trip planned in the future, that's going to depend on how the virus changes, and I'm not sure how that's going to go. I'm not sure if it's going to get worse in a particular area. It depends on where you're going, depends on where you're planning on going. European vacations, a lot of people are thinking about Europe this summer. I would say for anyone who's thinking about Europe or booked a trip to Europe this summer, I would say still plan on going, but get travel insurance. Now, let's talk about travel insurance for a moment. The routine travel insurance that you get by, you just click the box at the end of the airline ticket purchase process, whatever, that little checkbox, that thing, that's a really basic policy. That's not going to cover you if you don't want to go because you're afraid of the virus. It's not going to cover you if there's an increased travel warning to that area. It will cover quarantine. So if you get sick, or for some reason you're exposed, if you are, say, in a resort in I'm blanking on the name of the islands now, the Azores right now, and there's an entire hotel that's been quarantined. Okay, your travel insurance will cover that. So the basic travel insurance will cover quarantines. What I would advise if you have a big trip is I would try to seek a policy that's cancel for any reason. Get a cancel for any reason rider. And that way you can make a decision up to 40 hours before your trip whether or not you want to go. Yes, it's expensive, but with the fluctuating nature of this virus, that's the best advice that I can give you. Most importantly, I want you to remain calm. Okay? This is not the zombie apocalypse. We're going to get through this. It's going to be okay. Some people are going to get sick. It's going to be like the worst flu season ever, and then we're going to be fine. We made it through 2009. And we'll make it through this. Surveillance is important. I'm really happy to see that the CDC has started testing random patients now in a few states. So basically people that are suspected to have the flu and test negative now in Los Angeles, San Francisco, Chicago, New York, and Seattle, they're going to get tested for COVID as well. So we'll get so surveillance is important. If you feel better wearing a mask, okay, fine. Go ahead and wear it. It's not going to help you, but if it makes you feel better, that's important. Hand washing will protect you, and that's super important. So we just got to wait for the vaccine. Thank you very much.
We'll start with a political question. The thing that scares me the most is President Trump telling us everything is okay. Do you have any comments?
I have lots of comments, and I would try to be polite, even though this is Iowa City. I understand the motivation for the government, and I do. One of my messages today is for you not to panic. Okay, I don't want people to panic. Like I said, it's okay to be scared. It's not okay to panic about this. Trump is very concerned about the markets, very concerned about the stock market. He's trying to protect himself and trying to protect the market, so he's trying to portray a sense of calm. There's nothing wrong with the economy in the United States. There's something wrong with the economy in Asia. I was just in Japan. They saw a 6.4% drop in GDP last quarter. That's a lot. Now, that's before this started. And I'm going around tourist sites in Tokyo and Hokkaido, and they were empty because they didn't have any Chinese tourists. So is this going to affect the economy of Asia? Absolutely. Is it going to have a spillover effect on the United States? Probably, and probably down the line. So I understand his concern. What worries me more about our government is that the people some of the people that he selected for leadership positions, or didn't select because they never got around to it, and you have agencies that are run by people who have no idea what they're doing. And a good example was the Department of Homeland Security being grilled in the Senate just the other day, and he knew nothing about COVID. How do you not know anything about COVID? I mean, this is kind of important. So supposedly the press conference tonight will be with members of the CDC. Hopefully they actually use their science and actually remember they're scientists and tell the truth, and everything should be better. But I'm concerned about the people in charge.
To get down to some of the basics, could you tell us how they make a definitive diagnosis of COVID-19? And then also, could you talk about the possibility of further mutation?
The diagnosis is basically you test for it with a PCR, polymerase chain reaction agent, that matches to the genetic sequence that was released by the Chinese. The CDC has that test. It has not been FDA approved because it's been an emergency, rightly, and it bypassed the FDA approval process. There was some problems with the reagents when they released the test outside the CDC. Hopefully that's better now. And like I said, we're starting testing in those 5 cities. We're going to see more testing in the future. So it'll be basically, it's a PCR test of nasal swab or of bronchial secretions or of blood. And I don't know the test characteristics in terms of sensitivity and specificity, and that's going to change. The CDC has been very cagey about testing patients because they want to maintain a high level of specificity. If we just tested everybody, we wouldn't necessarily know what that meant, especially now that we know that it definitely can transmit asymptomatically. In terms of mutations, what you're seeing is what it is. It is a mutation. It's a mutation of SARS, right? It's basically SARS, like it's SARS-CoV-2, right? It's the second SARS virus, right? So it's gone through a lot of iterations in the bat population, and there's some sort of intermediate animal, maybe the pangolin, and then onto humans. So we've seen a lot. This is a mutation we're dealing with, and it potentially will mutate in the future. I don't know if it's going to be enough to really change the characteristics of the disease. I think what you will see is you'll see a decrease in mortality over time because we'll know how to deal with it. That'll be in most industrialized countries with good health care. And you're going to have increased number of cases tested, so the overall number of cases will go up, and the deaths will remain the same, so their mortality rate will decrease. So I think you'll see a decrease in mortality in the coming months.
This person is wondering what period of time a super spreader is infectious, for what period of time. And then also, can you talk about whether there will be a seasonality?
Mary, do you know about super? Do you know?
Super spreader?
Yeah, the duration? I don't know.
I don't think we know that much about that. No.
Yeah. I don't know the duration of when someone is, if a super spreader, how long they're contagious. The incubation for this period, for this disease is probably 5 to 7 days, probably longer. The 95% period, so the 95% period of people that of their contagiousness is supposed to be 14 days. So 2 weeks that someone is potentially contagious. So it's probably some variation on that. The super spreader doesn't mean they're necessarily contagious longer. This means that they shed more. Viral particles. And the other part of the question was the season. Yes, it is a respiratory illness, so it will have a degree of seasonality. So this actually brings up a good question, which what's going to happen long term? I think this is going to become endemic. I think that it'll just be one of those viruses that we deal with every winter. So respiratory viruses occur mostly during the winter because it's when we're inside, we're together, we're huddled in a basement inside a church. Oh, sorry. And it's when people are together and transmitting viruses. So influenza, RSV is a great example. I'll get back to that one later. RSV is a great example where that's a disease that's in kids that occurs more during the winter. And I think in the future, once this whole thing calms down, I think we'll just have a COVID season, and we'll see it throughout the winter. This epidemic, this is going to keep going.
You talked about the healthcare system available in various countries and how that relates directly to the ability to test, to treat, to have the facilities available. Can you talk a little bit about how certain countries or regions could be disproportionately affected?
I think it's a great opportunity to talk about Iran, because I think what's going on in Iran to me is actually kind of scary. Yes, authorities in Wuhan tried to cover it up initially, and that was a very sad case. And I think the Chinese made some mistakes initially, but they responded to that, and they really were much more forthcoming in January. And I was telling people back then, this seems a lot worse than we expect, because the Chinese are being really sincere about it, which is weird. So they must be really scared that they were right. Iran has not learned that lesson, and the mortality rate in Iran is like 22%. So all of a sudden, the virus is like that much worse. Yes, they have limited supplies. Yes, they may not have the best healthcare system available, but the dramatically higher mortality rate means they're only reporting deaths. They're not reporting all the cases, and so there's a lot more cases in Iran than are being said.
Just to build a little bit on that, can you talk more about social, environmental, and climate factors that may come into play in the development and spread of viruses like COVID-19? And you've already alluded to the fact that it maybe it's here to stay, but is there a more increased frequency that we should expect, sort of the buildup of pandemic-like diseases?
Complicated question, but that's okay. That's good. All right, some of the factors involved. We talked about cultural factors, about the origin in the live animal markets. We talked about society factors in spread in terms of air travel. Okay, so that's definitely going to make any virus like spread more to different places, trade in general. This is not transmitted through products, right? So if you manufacture an item in China and you put it on a boat and you take it, across the ocean, you're not going to get sick from opening that product when it gets to the United States. That's not how this is spread. This is spread by people. So it's that person going to the conference, that person meeting the business in person that's going to be spread the disease. Society factors, just like any disease, any respiratory disease, smoking is going to increase your risk. So higher percentage of smoking is higher risk of disease. If you have poverty, you're not going to be able to respond to the complications. Again, the mortality rate in the United States is probably going to be lower. We saw that with other diseases in the past because we have good health care for those that can afford it. And that's the key, for those that can afford it. So in places where they can't afford it, or in America where people don't have insurance, they're going to be disproportionately affected by this disease. Again, I think what we'll see over this year, we'll see this pandemic grow, spread throughout the world. You'll probably see some hotspots develop in the United States at some point. And then it'll run its course probably in about a year, or probably by the end of this year. And then it will become endemic. And you'll see, you can't close China forever. That doesn't work. So you're going to see, cases, appear kind of every winter. To go back to sort of the data, how reliable is the information from China, do you think? Ooh. Okay, that's a great question. I would say somewhere in the middle. That it is a big source of what we know about the virus. The clinical course, how people do that kind of thing, that all comes from the China's version of the CDC. And they just released now their report of 77,000 first cases. That was released a week ago. So we're getting some more information. And like I said, China released the genetic sequence as soon as they had it, which is really remarkable. This did not start in a bioweapons lab in Wuhan. This did not start in a bioweapons lab. Okay. Yes, there is a BSL-4, which is the highest level of safety lab in Wuhan. Yes, they have done some experiments on SARS. That is true. But the characteristics of the disease don't match that. And more importantly, it's just not necessary. We know this is in animals, and we know this was going to happen. Viruses evolve. I went through the history of new diseases. This thing will happen again. So don't give into the conspiracy theories about a weapons lab.
In terms of which countries might be most vulnerable, is it primarily population concentration, or are there other, you mentioned cultural factors. Are there other things that might drive how we see the pandemic develop?
Yeah, I think healthcare systems is the key. You want to look at a hard-hit country that's dealing with it well. Everyone points to Singapore. You've got a small island nation, right? You've got a high standard of living, highly advanced medical care, very controlling government. So that's all characteristics that actually plays in favor of managing this disease. So even though they have lots of cases, it's relatively controlled there, and they probably will be able to control it well. Italy's probably somewhere in the middle. It's happening in northern Italy, which is a relatively wealthier portion of Italy. You're talking about small towns. They may not have immediate access to care. But you've got authorities that are going to respond to it. And the opposite end of the spectrum, what we talked about, was a place like Iran, where you have poor infrastructure, where it's been hampered by sanctions for years, and you've got an authoritarian government that is just like allergic to truth, and they just can't seem to own up to what's going on in their country.
Do you, or how do you, or are social movements like anti-vax, sorry, I'm going to stop trying to interpret your question and just read it. How do social movements like anti-vax and homeopathy impact the future of pandemics like COVID-19?
For those of you who are Netflix fans, there's a series called Pandemic on Netflix, which is a documentary about making a flu vaccine. It's kind of interesting. I've only seen a couple episodes of it, but one of the second episodes deals a lot with the anti-vaccine movement, and really explains how that is a barrier to healthcare. And you can imagine. Now, let's talk about the flu vaccine very briefly. The flu vaccine is not a great vaccine. Please get it. Flu is an incredibly common disease. And in extremes of the population, the very young and the very old, it is incredibly dangerous. And for everybody else, it's really annoying. And it keeps people out of work and out of school. And the vaccine's only about 50% effective. That's terrible. But when you're talking about 1 million cases, if you can prevent 500,000 cases, that's a lot less sick people. The Ebola vaccine is incredibly effective, like 90% effective. That's fantastic. And everybody wants the Ebola vaccine because Ebola is really scary. Influenza is not so scary. So when the COVID vaccine comes out, everyone's going to want it. You should all invest in every company that's producing a candidate. Which company is going to win? I can't tell you, but I can tell you it's a race. So I can tell you the first one that has an effective vaccine is going to be the one that really makes the money off of it. And everyone's going to want that vaccine. And I really want to see what the anti-vaxxers, feel about a COVID vaccine in the face of the panic that that everyone's experiencing now. Vaccines in general is basically the higher the prevalence of the disease, the more people want the vaccine. So if it's like people talking Ebola, it's like, oh my God, I want that. It's really dangerous. People are like measles. Measles is kind of rare. It's like no one wants a measles vaccine. Everyone's fine with that. Measles is actually really dangerous. Just talk to Samoa how that's going.
This questioner wants to know what ultimately causes mortality in infected patients. You mentioned it's a pneumonia type of liquid in the lungs. Is that what it is, or what's actually the cause of death?
Sure, it's a couple of factors, and in ARDS, it's basically the lungs fill with fluid. So you can think of that as basically you drown in your own secretions, which sounds terrible, and it is terrible. You die of a respiratory failure. Basically, you put on a ventilator, You put on a breathing machine. We keep increasing the oxygen level, increasing the pressure of the oxygen level until your body either gets better, or because of there's so much of your lung that's covered by water, you don't get the transition of oxygen, and you get hypoxic, means low oxygen level, and then you go into multisystem organ failure. So it's kind of a bad way to go. The other way to go, which is related to that, and this is the same thing that happens in influenza, is that you get a bacterial superinfection. So your immune system gets depressed by trying to fight the COVID or trying to fight influenza, and because of that, you get a bacterial infection on top of it. Something that we see all winter long, and I just had a case of this just the other night, is what I call like a bimodal infection curve, where someone comes in and they about like 2 weeks ago, they had like a viral illness and they felt like they had the fever and they felt like the flu and they had a sore throat and cough. And then they got better. And then they got worse again. And it's that getting worse again is now a bacterial superinfection, like a pneumonia on top of things. And then people die of the sepsis from the bacterial infection. So that's the two ways.
We are winding down. Thanks for being so great about answering all the questions and such a variety of them. On the news, we see people, workers who are completely suited up and they're spraying sidewalks and roads. Is that doing anything useful, or is this just a political trying to help restore the faith in the public?
It's funny. I'm glad you asked that one, because we were, as I was preparing for this talk, I was flipping through New York Times photo essay from China, which they have fantastic coverage, and they showed a bunch of pictures of people cleaning surfaces, and there was one where they were spraying bushes. With what? For what reason? I have no idea. That is just making pictures. There is a point to cleaning surfaces in general. Now, the specifics of where they're cleaning it and how they're cleaning it, I can't comment on. But as we talked about before, which is really super important, this is absolutely spreads by surfaces for sure. Okay, so if I vomit on a table and I try to wipe it down not very well, anyone who comes in contact with that table the next hour or two can get the disease. Okay, so cleaning a surface where people have been, say in a bathroom, for example, super important. Okay, spraying bushes with steam, I don't know what they're doing.
Okay, we're going to end on some civic question that's twofold. One, I think, is relatively easy to answer, which is whether it's possible for you to share the slides of your advice with us through the ICFRC. And obviously, we'll also be able to have that rebroadcast on City Channel 4 if you want to share that with other people. So thank you for sharing your presentation with us. And then bigger question, do you have thoughts about the best practices for a county or city to roll out to its citizens to help provide information and advice?
All right, that second question is a really good one, and our public health authorities are being very good about working with the CDC, using best practice information, using actual science to make good recommendations about how to manage. Couple of things we need to do. We've got time, so Iran, South Korea, they're in the middle of it now. But the United States has bought time to prepare. We've got maybe weeks, we've got maybe months, maybe more. And so we've got to take that time to stockpile personal protective equipment, PPEs. So that's the masks and gowns and that kind of thing. We need to produce more and have them available. Obviously, the vaccine would be great, but that's going to be further down the line. We need to inform the public. We need to inform the public about hand washing. We have said all these things before for influenza for years, and most of the time people don't pay attention. Maybe you'll pay attention now. So I think this is an opportunity to take the same information that we use for influenza and make it public. Just change just Photoshop the slide to change from influenza to COVID, and you can make the same recommendations for public health. Stay home when you're sick, unless you need medical care. and avoid large gatherings when we get into the epidemic, and good hand washing.